Hello, my name is Tanvir,
And my name is Janine.
and we are from United Sikhs, an organization committed to humanitarian relief, human development, and advocacy, aimed at empowering those in need, especially disadvantaged and minority communities from across the globe.
Punjab, a northern state of India, has been suffering for decades from an escalating epidemic of narcotic drug use. Today, we'll be talking about how the COVID-19 pandemic and India's strong response in terms of its lockdown could play a pivotal role in deciding the future of Punjab's opioid epidemic.
Punjab suffers from the country's highest prevalence of non-tobacco, non-alcohol related substance use disorder, with a rate of 2.5%, compared to 0.1% in states like Gujarat and Kerala. Opioids are the most commonly used illicit substance within Punjab, with a high prevalence of 1 in 120 of the population currently being dependent on opioids.
The 2019 World Drug Report provides critical insight into the underlying geopolitical influences exacerbating this situation. The Indian state of Punjab shares its northwestern border with Pakistan, which in turn neighbors Afghanistan. For years, Afghanistan has dominated the production of illicit opioids and was the country of origin of 88% of the heroin and morphine seized globally. Punjab lies directly on Asia's drug trafficking route, through which opioids produced in Afghanistan are trafficked to neighboring countries like Pakistan and India, and then onto South and Central Asia. Pakistan was therefore the source of 53% of the heroin seized in India in 2017.
India's strong lockdown response in response to the COVID-19 pandemic has disrupted drug trafficking routes, supplying narcotics to Punjab. As a result, there's been a surge in the number of patients, as you can see in this newspaper article, that were seeking de-addiction services. As many as 86,000 new patients registered themselves at outpatient opioid-assisted treatment clinics throughout the state. And this number alone represents more than 10% of the estimated drug users within Punjab.
The impact of India's response to COVID-19 has worked in favor of supply reduction by significantly reducing the inflow of opioids into Punjab. But in order to harness this momentum, it's now necessary to focus our attention on demand reduction strategies. The Punjab model is a comprehensive structural model of de-addiction service in Punjab, which focuses on demand reduction strategies. It was developed in 2015 with the expertise of psychiatrists specializing in addiction medicine, as well as the Punjab state government.
The basis of this model is a three-tiered pyramid, as you can see. At the bottom is the primary level, community-based early identification services. Then is the detoxification and relapse prevention services at a secondary level. And then finally at the top, the tertiary level is the management of more difficult cases. And so the success of this model relies upon the integration of multiple services within each level and the flow amongst these three tiers.
However, in producing this model, several weaknesses of the current de-addiction services in Punjab were identified. Firstly, there were inadequate rehabilitation services for the current demand. Secondly, there was poor coordination amongst organizations and agencies and a lack of a general collective strategy. And thirdly, there was also a need that was seen for community education and outreach programs. These issues have helped form our recommendations, as we'll detail now.
United Sikhs is an organization that envisions a well-structured and sustainable drug de-addiction program within Punjab. We see the post-lockdown period as a very rare opportunity to bring about long-term change that may play a pivotal role in deciding the future of Punjab's opioid epidemic. A cohesive, coordinated post-lockdown strategy is urgently needed to be developed in order to minimize the risk of a widespread relapse. It should be focused specifically on treatment in regards to treatment follow-up and rehabilitation.
This will require improved collaboration between the public healthcare system and other organizations involved, including NGOs, self-help groups like Narcotics Anonymous, as well as spiritual or religious organizations.
A collaboration between hospitals and other organizations like NGOs capitalizes the strengths of both groups. So for example, NGOs are more suited to facilitating outreach programs, linking rural communities, which we know are an at-risk population for substance abuse, and linking them to de-addiction services. On the other hand, religious organizations have the social influence to facilitate educational programs, thereby reducing the stigma associated with substance use disorder. We believe this collaborated, coordinated approach may strengthen the Punjab model that we've discussed and ultimately reduce the risk of relapse by improving the quality of care across the primary, secondary, and tertiary levels of de-addiction services within Punjab. Thank you.
Thank you.